everybody. My name's Tom Howard, and we're going to be talking for the next 45 minutes regarding psychedelics and cannabinoid therapeutics and what does the future hold. You can find me on the internet at cannabisindustrylawyer.com. It's my law blog. If you've ever tried to get a cannabis license, it wasn't in this state, but if you try to get one in another state, you probably came by my work, and then you might have found our podcast that's pretty popular on any podcast provider, but we do it live on YouTube on Wednesdays and Sundays. That's Cannabis Legalization News. Check it out. You could be the 23,250th subscriber if you act now. And with us today is just a wonderful panel filled with a lot of experience, and we're going to have a fairly deep dive. So briefly, let me just introduce them. And well, I'm not going to introduce them. I'll let them introduce themselves because they could take 2 whole minutes and tell you their entire backstory, or at least as much as they can in 2 minutes. So starting with my left, please go for it.
So my name is Daniel Tobin, attorney by training, have been in the cannabis space since 2012. Really got interested in alternative therapies, not just cannabinoids, but also psychedelics after coming back home from combat tour in Iraq. Led a sniper team, was polytrauma TBI patient from being a little too close to a couple of explosions. Came back home to go to law school and realized that there really wasn't any effective therapies for what I was going through, which was TBI and PTSD-induced depression, attention deficit disorder, and anger management. My brother, who's a physician, and my wife, who's also a physician, kind of helped guide me towards some of these alternative therapies. I did do some experimenting with psychedelics and microdosing after coming back. What really worked for me ended up being cannabinoid therapies. So my interest in that grew very heavily to the point where I now started several cannabis companies and am the CEO of an international cannabinoid API generation company. That's pretty much long and short of it.
And thank you for your service, brother. I also am a vet myself. So.
Oh, there you go.
My name is Keith Johnson. I'm from Shelby County, Indiana, and co-owner of the Carboxyl Group. And what we do is we grow, we cultivate. We're not this year. We're concentrating in another area, and we've had retail products for sale through our website since January or February, I guess, of 2019. And now we're getting ready to move into full-on extraction lab operations. My experience with mushrooms, psilocybin especially, is I too have a traumatic brain injury. I went through a windshield at 70 mile an hour, and the psychedelic application of, or a therapeutic psychedelic experience that, to be quite honest, was not intentional. I didn't expect the results that came from it. And then I got into CBD after doing more research, and basically I healed myself. In 9 months, I got off 11 medications that ruined 1/3 of my liver and brought my kidney functions down to 62% filtration rate. But I'm back, I'm medication free, and was back in college at age 47 at Purdue in biomedical engineering. And those connections, thank God for college kids. Older people can say whatever they want, man, but they got me back into the hemp area, marijuana, even further looks in music festivals. I'll just leave it at that. And yeah, I healed myself. So that's why I'm sitting here.
Thank you. Hi, guys. I'm Dr. Lola Ahamba. I'm a clinical pharmacist by trade, and I'm also certified in medical cannabis. I'm the founder of WCI Health. We are alternative health and wellness company. We help people get and stay well using the healing powers of botanical. I personally help healthcare professionals, dispensaries, and people that are new to cannabis or plant medicine understand the science behind it, how it works, so that they can help their clients or their patient on their wellness journey, saving money at the same time, avoiding drug interactions. And it doesn't necessarily mean the plants. There are a lot of our clients that are on other medication, on other disease states. that can interact. So I help navigate that space. I was originally from West Africa, and growing up, we used herbal medicine. That's the first line of therapy for us growing up. So I'm bringing that knowledge as well as my clinical background to help people navigate this space. I'm the author of A Pharmacist's Guide to Cannabis, Perspective of a Non-Conforming Clinician. That's like our basic guide, especially for people that are new to the space. And I also have a podcast, Let's Talk Plant Medicine, Cannabis, Psychedelics, Pharmaceutics with Dr. O. I host 2 shows on Clubhouse, so come check it out. Thank you guys for having me here.
Awesome. Well, we have a lot of knowledge, and usually when we have a cannabinoid and mycelium thing, we're going to be talking about how mycorrhiza helps your root structures for your cannabis plants. We're not going to be discussing mycorrhiza really at all today, or your root structures for your cannabis plants. One of the things that I would want to know, because we have personal knowledge and also clinical knowledge on the stage, I would ask the people that have the personal knowledge. But how did you find out that this was going to be effective medicine for your ailments?
Luckily, I had a good support system of people who were trained in traditional medicine. My brother's a physiatrist specializing in pain management. My wife is a transplant hepatologist. And they kind of saw firsthand my affliction, knowing me before having experienced what I experienced in combat, and seeing how that kind of affected my personality and my mood and my ability to focus and work. And they also understood that the kind of traditional courses of therapy that I have been prescribed were absolutely not working, and in some cases exacerbating some of those conditions that I had. I think the earliest research specifically on the psychedelic side, there was several German doctors that were doing trials with LSD to cure what they call suicide headaches. So migraine so intense that a significant portion of the patient population was actually committing suicide in order to seek relief from that.
Wow.
That was kind of the first breakthrough therapy research that was actually performed on psychedelics. And then people kind of took that and created the analog through psilocybin. While I tried, psychedelics are, in my personal experience, a fun time. I used to go to Burning Man every year, but it did not work for me as a therapy the way that cannabinoids did. I still, I went to a very competitive law school, and I still needed to concentrate. I was a securities lawyer after that, tech founder before getting into the cannabis industry. So I needed something that was I could modulate a little bit easier, was more accessible, and didn't kind of have the high risk profile of a very kind of
Having too much.
Yeah, exactly. It's when you're talking about micrograms as a dose, and my state and the Seventh Circuit had some pretty strict mandatory sentencing guidelines, which I knew about being a law student. You're carrying around a couple of hits of acid that could land you in jail for 15 years. I would have to carry a lot of marijuana on me in order to kind of face those similar sentences. So for me, it was both cannabis was just a better therapy for me overall, fit my lifestyle and what I was trying to do. And it also just worked better for me than the psychedelics I had at my disposal and was able to try at that time.
Keith, what about you?
I found it out of desperation. This was probably 4 years ago, and I watch a lot of TED Talk videos and a lot of science, and I'm getting quantum physics and things. And one thing led to another with my research about the brain and how we function. Neuroplasticity led to the psilocybin TED Talk on neurological neuroplasticity, and that is the brain's ability to continue to reroute and make new connections throughout the course of our life. Now, it wasn't when I'd had my injury in '95, they said 2 years and you're done, your brain won't go anymore. And I didn't believe it, and it turns out I was right. But So I saw this video and on a TED talk on psilocybin and neuroplasticity, and I was like, holy cow, man, this is what I need. I need the fMRI, the functional magnetic resonance imaging system, to light up when you're tripping out, right? If I can see that in this video, and if she can talk about that and talk about what happens as a consequence, this neural rerouting around the damaged areas, you're using new areas of your brain for things that it's not supposed to be doing, then maybe I could do it. And so I kind of put it out of my mind. I went to a music festival with some friends, and that happy accident, maybe you could say it was a case of bad judgment from a couple beers, or I don't know what, but it changed my life. I woke up the next day, things were different. And so that's how I found it. TED Talk. They're amazing.
Yola, what about you? Have you any personal knowledge, or could you explain to us in your clinical experience the benefits that you've seen in your patients?
Thank you for that question. I personally have not used psychedelics per se. I do use cannabinoid therapy. But when you're looking at, just like Keith was saying about the brain, this product being able to help reroute the brain, what I do is like I look at the science of it. And basically our brain, like when we are not doing anything, you're sitting down there by yourself, that time of the day when you sit down by yourself and your brain starts telling you, oh, look at your neighbor, did she even greet you? Oh, did I do my work today? You know, like you're so critical of yourself. That is our default mode network. That is that part of the brain that criticizes us is what they call default mode network. And basically what's going on in that brain is that everybody stays on their own lane, like Keith was literally saying. Then when you bring in the psychedelic compound, basically what happens is like it comes in there and it's like, whoa, we're not gonna sit down here doing nothing. So when this compound comes in, all the part of the brain that hasn't been functioning, that has been staying in their own niche, suddenly begins to interact. And when they interact, just like we are in this conference right now, a lot of ideas is going into people's head. People are exchanging business card, things like that. That, oh, I could do this, I could do that. That's exactly what Keith was saying. But when you come to the science part of it, we have a system in our body, the serotonin receptor, which is just like other receptor. And when I'm talking about receptor, that's how our body works. It works the way I explain it to people is like a lock and a key. Your system is your padlock. And your key is the chemical, is the active compound that you have in your medicine that comes in, and you turn that key and the door opens up for you. So in this case with the psychedelic, most of them work by the serotonin system. And we have found out that what other medication use that system? That's our antidepressant and most of our antipsychotic medicine. In fact, the medications that we use right now for depression and anxiety and all those PTSD, most of them were discovered after the LSDs were discovered. And they formed these medicines that we now use based on the mechanism of action, the way psychedelic works, based on what they discover from how those plants works. That's how they were able to form this medicine that we use now. So the way psychedelics basically work is that it goes into your system. Normally your system will package the chemicals in like a vesicle. When we talk about vesicle, we're simply talking about like a balloon, little balloons. It packages, it moves it to the outside where it goes in your key and the door opens. But what psychedelic does, especially ecstasy, MDMA, is like they go into that system. Instead of allowing that system to package as a vesicle, they just spread it out. it preventing. And as such, you have the rush of your serotonin going into the system, and that's when you see trip happen.
Interesting. Before we change to the regulatory aspect of the difficulties in this type of study and also the type of access to the medicine, especially safe access, I wanted to ask Dan and Keith about their former pharmacological cocktails that they were on. But first, Dan, we've talked about psilocybin being effective for Keith, and you preferring the cannabinoid medicine. Let's expand on that a little bit, because as you guys know, this is a CBD expo, and CBD, of course, CBG begat CBD, which then can also go into THC. And so there's a lot of different cannabinoids. And after that CBG, in the same trichome head and that glands, on the bract of the plant, it can start creating terpenoids. And those terpenes create what they call the entourage effect. Dr. Ethan Russo would describe it as. And it also makes the different smells and tastes and flavors. So Dan, did you find that particular strains helped you better than others? If so, what terpenes do you think are good for you?
Yeah, so I mean, I never got kind of that down the rabbit hole of figuring out. I just knew a low dose of a THC dominant cannabis, and I'm talking fairly low dose, again, because I had this kind of intense high functioning job. It did more than anything else I tried. And I also, back in 2006 when I got back from Iraq, there really, wasn't a way to really, in Illinois, to kind of get sampling that I could kind of do experimentation on my own for. Weed was weed.
Weed was weed.
And you got it wherever you could get it. Either your friend, was finding a way, or somebody at law school had it and they would sell it to you.
His name was Badir for me.
yeah, and Michael for me. But we, when I first got back, I started some traditional therapies. At first, they tried Strattera, which was a serotonin reuptake inhibitor, and what that did for me was make me hyper alert, super paranoid, and didn't allow me to sleep. So if you're talking about somebody who's literally saw combat and tried to start law school 72 days later, being hyper alert and paranoid and not being able to sleep is not a good way to succeed in a competitive graduate program. After that, I went to a series of methylphenidates, and we tried everything from different analogs, different isomers. There was a new methylphenidate focalin, which had just come out very recently, which is a left-handed isomer, slightly different variation of the molecule. And that was supposed to be kind of a low incidence of side effects. It just made me angry all the time, like noticeably angry, combative. I actually got into a verbal altercation with one of my professors on the second day that I was trying it. I did everything that I could do as a patient to inform my care provider of what was happening and how those treatments were affecting me. And their only response is, try this other slightly different drug. And so, having seen kind of my cohort of veterans that were coming back with me and their failures in their therapy, I definitely didn't want to end up in some of the places that those guys ended up. I basically knew that I kind of had to take this up on myself. And much like Keith, my brother came to visit me, and he's like, "Man, you're a wreck. What the hell's wrong with you?" And I kind of gave him the whole history, and him as a doctor understood. And so we're like, "All right, you're gonna relax. We're gonna go out with my friends. We'll have a fun time." We ended up at a friend's house, and he's like, "Hey, man, you need to calm down." And I'm like, "Nah, I'm a law student. I don't want to smoke weed. I don't think it's good." I smoked from a piece, and it was the first time I felt like I was back in my own head and I could actually concentrate and I could actually relax. I wasn't angry. I wasn't tense. I wasn't looking out the window to see if somebody was coming. I was going to law school on the south side of Chicago, and unfortunately, I decided to live on the flight path of U of C's flight medevac. So having helicopters constantly over your head after you've just come back from Iraq was probably not a great idea. But my experience with cannabis allowed me to kind of relax, get some sleep. I didn't imagine that it was I was being extracted in the next 5 minutes by helicopter, so like I didn't have to be awake and aware. And then it was just about dosing and regulating that dose and using that medicine responsibly, just like you would any other prescription medication, in order to fit your kind of needs and your lifestyle. And that's basically how I got there.
So go to law school, smoke weed. It's worked for us.
I do have a terpene preference.
Go for it, Keith.
As a formulator, that we make CBD oils and things that come in. I'm the formulator. Linalool. You've got certain terpenes that they're kind of more tailored for an anti-anxiety relief. That peace and calm you like, as opposed to an anti-inflammatory type function. And what I found was when there's a low pressure system in, how that weather pressure system can bother your knee or your back, especially if you're getting like a gray beard like me. It also affects the brain injury, because you have brain inflammation. It's part of this ongoing thing you always will deal with, no matter how better you get. So on a nice stormy day like we had the other day, my memory tanked, everything else. So I mix myself up a special terpene profile for my CBD oil, and I do that from time to time. And I went heavy on the myrcene, which has got great anti-inflammation and pain-killing properties to it. And I went heavy on limonene. And then to ease the burden of it, I used some beta-caryophyllene and really topped the tincture out that day with that. And that took that anxiety component of the struggle I go through with on bad days and really fixed it right up. So for me, terpene profiles, man, that's everything. If you get a full spectrum oil from a company, you should ask to see, well, what's your terpene profile? What is your oil geared for? Is it geared more as anti-anxiety, sleep, anti-inflammation, anti-pain? And those things all come down to terpene profile. So what plant was it taken from? What is the profile of that plant? These are things that are very valuable for the CBD user to know and the medical marijuana user to know, because it means so much. And that's an entourage effect, that synergistic effect. And so it means a lot to me, and I tailor my own stuff. And luckily I'm in a position I can do that just for specific terpenes.
Lola, in your practice, are you seeing any differentiation in your cannabinoid therapeutics where you pay attention to the entourage effect and terpene profiles?
Yeah, what we normally do is it has to do with the dosing, because of when you're talking about cannabinoid in particular, they are what we call biphasic. So it depends on what we are trying to manage. Say, like if we are trying to help somebody to calm down or to sleep, you want to use CBD, then like Keith said, probably mycin, which has that calming effect that's gonna help you sleep. So it really depends on dosing, what you're trying to manage. Then you can be able to tailor that biphasic properties of your CBD or other cannabinoid to the topping. The other topping that we have seen that work with stress, anxiety, is the linalool that Keith was mentioning. So when you are combining those two with your CBD, you tend to see that relaxation. But also the other thing that we have seen is that in CBD, during the day, it helps people to be awake. So for some of our clients that have we call it like a problem with sleep, like narcolepsy, basically what that means is that they sleep during the day when they are supposed to be awake. So CBD is being able to help them, because in the studies they have shown that during the day it helps you to be awake. So they are seeing all those results in clinical studies.
Yeah, I've heard CBD on both. I've heard CBD can help with sleep, but then I've also heard that where CBD promotes wakefulness. And
It promotes what it does is that it enhances the effect of THC during sleep. It doesn't really help you to sleep, but when you are using it with THC, it tones down the not so cool effect of THC, and that depends on the dosing as well, because low dose THC calms you down. Is when you start getting to the high level of the THC, that's when we see the hyperactivity, the neurological psychoactivities of it. So what CBD does, the way I explain it to people is it's kind of like a husband and wife, good old husband and wife. They get on each other's nerves sometimes, but they also work together perfectly well. So what happens is your CBD is coming in there and kind of modulating the effect of THC, and the effect is kind of tampering down is all those psychoactive effect that a lot of the time we don't really like it.
well,
So
thank you for explaining that. That helped because I was always kind of confused by how CBD could. Yeah, I've heard it promotes wakefulness, but other people swear by it for sleep, and it makes a little bit more sense. And so now we're about halfway
And
through.
if I can just quickly add another thing, when also the beautiful thing again with CBD is that it doesn't just do it in the CB2 receptor that we talked about. When it's working with THC, most of the time, it's working on another site that they call allosteric site. Then the other thing is that it also binds to the serotonin 1 receptor. What does our serotonin do? Like in the psychedelics, they are that part that comes and help. There's a lot of them. They do all kind of stuff. But one of the main thing that we see, especially when it has to do with your brain, is that it calm you down. So that CBD working as a 5-HT1 serotonin 1A receptor, coupled with the fact that it can also act as a modulator to tamper THC down. Those are part of all the activities that is going on with your CBD. It's a Robocop. I call it a Robocop of our time, for real.
And that's kind of like the really interesting and exciting work that's going on behind the scenes with a lot of the kind of advanced product manufacturers. Is people are kind of getting these compounds are getting more normalized. More people are taking these compounds. We're getting more feedback and more data about how these compounds affect people. Not really yet at the clinical trial level, but we're getting enough data to now, as a company, if I want to sell more product, I'm starting to gear my products towards effect-based formulations. I want things that do a certain thing and are repeatable and reliable. Most of the products that you see out there in the world today, and most of the products that we have, are very simple formulations. They're very direct extractions, and then people kind of gravitate towards one another based on what they get. We're not that far away from you being able to go to a Walgreens and Walmart and buy a specific CBD formulation that has a specific claim attached to it that's been verified by the FDA in some capacity.
People would be doing it now if we were allowed to.
Exactly.
We're just not allowed to.
Yeah, if we were allowed to do it, we'd be doing it
This
now.
is getting into the back half of the presentation that I thought would be great to discuss. We've already started to bring it up. This regulatory, I'm not even going to call it a hurdle. It's just a straight up brick wall, depending on what you're trying to study. And so, Dan, we'll start with you. Because you have some knowledge on both sides of the THC and the CBD industry, and then also you had medical cannabis effects and benefits as well. What is your opinion of the current federal regulations regarding cannabis?
It's complicated because it's very silly that this is a Scheduled I substance, but at the same time, the way that the industry has progressed and has been built over time, if cannabis were to be descheduled tomorrow, that means the FDA would start taking it would take its purview and start regulating this. Most cannabis companies in the US today would be out of business tomorrow if the FDA started regulating them. Their production facilities are not up to spec, even for a basic ingestible that's not making health claims. And it would be fairly devastating to all but a few of us who decided to build their manufacturing facilities to a CGMP standard from the beginning. There is this kind of catch-22 with deregulation right now. I think we're moving to a kind of more sensible regulatory structure that's going to allow people to get the benefits of these compounds much more safely and much more efficaciously. But there are dangers in kind of moving too fast to deregulate. I'm a proponent of deregulation. I'm a huge proponent of deregulation. You should be able to buy, really safe, effective CBD medicine at your local grocery store. You should be, if you're over 21 or 18 or whatever the state decides to regulate it, you should be able to access THC medication safely. I think the same thing goes with psychedelics. But because they have this history of being a Schedule I substance, really been formed yet, and the FDA and state governments and state health departments have a lot of work to do in order to make sure that there's a sensible path forward to getting these medicines out there without kind of squashing the industry that's already popped up. And sorry guys, but I gotta run to a conference call that I can't avoid, unfortunately. Other lawyers that I gotta talk to.
Well, don't forget to bill your time.
Yeah. But please find me if you have any questions.
Thank you.
Thanks, guys. It's been a pleasure.
Now, Keith, you have expressed that you've gotten a lot of benefits from medicinal use of psychedelics. What is the risk you run to access your medicine?
Well, 20 years in prison.
Are you a resident of Indiana?
Yeah. Listen, I mean, it depends on the prosecutor what they will do. But what they can do is frightening, and I can't sit here and tell you the exact punishment for how many grams of some kind of psychedelic mushroom you might have. That's why I like music festivals, because you're anonymous there, you go there, they're there, and it's a pretty safe place to do your reset, what I call it, but to trip. But it's a safe place to do it because you don't want to be taking the chances of driving around. Now, I have, this last winter, I got my Schedule I controlled substance registration license in the state of Indiana. I'm the only hemp operator in the state that has it. I laid the groundwork for this license for hemp labs. And part of that, they didn't specify, THC only. They just, all Schedule I compounds I'm allowed to research. My lab is an analytical and compounding lab with the state now, registered with those guys. So, and I know I dressed down. I didn't expect to be here today. I don't look the part at all, but yeah, I'm a lab geek, man. And so since they didn't specify that, guess who it can legally have in the lab setting? Psilocybin mushrooms. I think I can, but I'm not going to risk it. But they issued the license. The governor signed it, and I need to talk to a lawyer about this before I do this, but we already do mushroom extractions of various mushrooms, like I'd mentioned. We're set up to be the first group in Indiana to be able to legally look at this stuff, and I am terrified of it. If I even have them on the grounds, I could lose my license. I don't know how all this is going to play out, but they need to get it straight. They needed to get it together to where people like me, who are out here trying to help people like you, have the legal ability to do so without looking at 20 years in prison. It's a damn shame. What has happened has resulted in unnecessary harm to people and loss of life, in my opinion. And it's borderline criminal. But that's just my opinion. They got a lot of work, but it was right, If they go and deregulate tomorrow, it's going to be a mess. You can't just say legalize it today. The libertarian in me says, yeah, that's a beautiful thing. But we can't do that. It needs regulated. CBD needs regulated. We got stuff being made in people's garages. Yeah. And when you say, is your lab a positive pressure filtrated? No, they're like, what are you talking about, man? I just make it on the workbench. So this is what we're dealing with. And those guys need shoved out of the industry immediately. But it's those same regulations that are going to kill everyone else that's so close, but they don't have the money.
It'll push the cost of trying to get, for example, an extraction or a manufacturing type license to the moon. how long did it take for you and your lab to get this DEA clearance?
9 months. 9 months. Like I said, when I'm at the first board meeting, all these board meetings last year were Zoom meetings, but the first board meeting, you see everybody and they see you. And I'm in there and they said, okay, next, Keith Johnson, the Carboxyl Group, what's your request for? And they had the paperwork, they knew. And I told them. And she says, why are you here? They just could not fathom. So I told them the legalities. And I'm doing a series in the educational series tomorrow in one of these rooms at 2:15. It's about the controlled substance license and why you might want to think about it as hemp operators. But when I explained the issue of the legalities at distillates in particular, at a certain point, they're all illegal, technically liquid marijuana, but they could shut us down for that. So it needs regulated. They didn't clear it up. That's why I went and got the license. And hopefully Indiana will come around one day to where I can do like psilocybin extractions. And I'd have a hard time giving it to mice, though. I'd want to take it myself. So that's another issue.
Well, you only need a few micrograms.
Yeah.
That's fascinating. Yola, how has the prohibition on many of these therapeutic substances impacted your practice?
Personally, I just like was it Dan that said it? That is just ridiculous, because right now you have psychedelic like psilocybin and cannabis and Schedule 1. Basically, what that is telling us is that there's no chance in anywhere, heaven or hell, Pluto, that you should be able to use it as a medicine. But we already have the synthetic. We have dronabinol that we are giving the patient for cancer to help with nausea and vomiting, and for HIV/AIDS people to help them to eat, that doesn't have the topping, that doesn't have the flavonoid, all this other stuff that you get in your veggie. It doesn't have the toppings, it doesn't have the fibers, just synthetic, take it out. And we are giving it to the most vulnerable people in our society, but you have the plant that has everything that folks need as a Schedule 1. It doesn't make sense. For me personally, for my group and the type of clients that I have, we have of the proponent that they should classify it as a nutraceutical. This is botanical. It's not different from our spinach or our garlic. It is grown. Nature gave it to us. Does that mean everybody should just go and grab it? No, that's not what I'm saying. The beautiful thing about cannabis is that it has cannabinoid. There are some other plants that we are discovering that also have cannabinoid now. You get what I'm saying? What I'm saying is that the more we keep putting it as a drug, then they're gonna say, okay, you have to prove efficacy, you cannot prove. There are all those kind of things with the botanical. What you grow in your yard is different from what Keith is gonna grow. So we're not gonna get the same result. Why are we treating it as a medicine? Can't we treat it as a nutraceutical, like our garlic, like our anything green, you are not supposed to eat it. Does that mean green is bad for you? No, it doesn't mean green is bad. It's just that green has vitamin K in it. And that vitamin K, if you take it with your warfarin, it can make your blood to thin more. What does that do? That can get you to bleed, internal bleeding. That's why we say don't take it with spinach. We know how to manage this stuff. You get what I'm saying? And they just need to stop being ridiculous and give folks what they need to work.
And I think part of the problem is the FD or the USDA, the DEA, they don't have hemp knowledgeable people. I don't even think the DEA has marijuana knowledge.
They don't even know the difference between THC, Delta 9, and Delta 8. Yeah. I am seeing people talking, oh my goodness. I'm like, look here, folks. There ain't no difference between these two. It's just a shift of one group to another group. And these people don't even know. Now they are arresting people for having Delta 8. Well, you left the loophole because you don't know. And I'm not trying to hit them on the head.
Yeah.
We just need to give people medicine that they need.
I believe the fear of the propaganda that's been instilled over us or into us
Like
over
I was
8
telling
decades.
you know
that's
what?
going to take a long
When
time.
I was
to get over.
little, we used mango tree, the plant, the bark and the leaf of mango tree to treat malaria. Fast forward, when I became a clinician, it dawned on me that though what's going on there was that our forefathers, our fathers, they are so smarter than us. Then they weren't even scientists. In that mango tree, you have quinine. Quinine sulfate is what we dispense now in pill form, and we give it to you. If you are traveling to third world country, we give it to you to take. The same active ingredient in your mango, in your lemongrass, was quinine. And that was what they were using to manage malaria. But we package it and sell it at exorbitant without the toppings, you know. So they just need to get people that knows about the science to help them to manage this space.
And it feels like they have nobody there.
Well, we're in Indiana.
Yeah. And God love this state, I do, but
Right, and I think that they're going to be in one of the last states to have a medical cannabis program, one of the last states to legalize cannabis for adult consumption, and one of the last states to ensure safe, pure access, because there are people growing weed right now in this state. They're just doing it illegally. We don't know what they're putting in the weed. It's not tested before they sell it. These guys aren't, checking ID. But for whatever reason, I don't even think you guys have a bill to legalize medical cannabis in the state of Indiana. And I don't think you have it because it's a political axe to grind, which I don't understand. Like, what is the politics of creating a law? And why is the state unable to figure out how to regulate a plant that hasn't killed anybody?
it's just fear.
Thank you for
It's just
saying
fear.
this plant has not killed anybody. Do you know how many folks opioid has killed already?
Per year?
Seriously?
It's like 500,000,
And
I believe.
folks, this plant has not killed anybody. Zero. And do you know why it cannot, especially cannabis, why it cannot kill anybody? Because your part of your brain where that controls your respiration, that controls your heart, that causes people to OD and have a respiratory depression and die from opioid, does not have a receptor for cannabis in your brain. It's in your brainstem. It doesn't have. So cannabis, when you take it, it cannot bind to that part of your body because there's nothing to bind to, so it cannot literally kill you. What happens is that when you take it, it works. If it doesn't have a receptor in other places, you give it a couple of days, 3 days, it's done. Education is what we're gonna need. And you guys that are here, you're gonna go in your community and begin to educate people. That's why I'm here. I'm all the way from Jacksonville, Florida. I have product. I have Glows Beauty. I have hemp-derived CBD product. I don't even remember to talk about my product most of the time when I'm talking about this topic, education, decriminalizing this stuff. Because that's where we need. People need their medicine. This is medicine. We are the clinicians that dispense this drug.
Did anybody
crazy.
ever
It
spend
is
an
crazy.
hour in jail over the cannabis plant is a travesty. It just truly is. That's what I believe. But
Yes, we have 5 minutes, so let's open it up to questions.
Okay. Yeah, one thing I observed is that
We actually have a mic. I think they're trying to record it too, so just a moment, please.
yes, sir. Yeah, one thing I do observe is that all these things depend on states. Like Miami, Florida. I mean, they're not so much into the law or the So, I mean, mushrooms or all these synthetic or even the real anything but here, when you come out like to Indiana, I see a lot of restrictions, you know. It's like a code. There's kind of some
It's a
coldness.
scared state.
Yes.
It's a scared state.
Yes. You know, because in Miami, basically, you can call and they deliver anything you want, like a pizza.
Wow.
Yeah.
You know, that's how it is now.
Well, you can do that here too if you know the right people.
Okay.
But there's just far, far fewer of those right people.
Yeah.
You know, in Miami, you got.
I don't live in Miami. I live in Jacksonville.
Yeah.
And when I go to Miami, anything you want.
You're like at the buffet.
They deliver it to you.
Yeah.
You know.
I used to live in Florida for 20 years.
There
I
could be
get it.
cultural differences.
Yeah.
There's another question.
Thank you. Seeing that you're from Indiana, and I did notice you mentioning, the legalization issues that you have here. What is the promise that the governor that's blocking everything is still going to remain in office after his current term?
Actually, I'm from Illinois. I feel bad. Like, I don't want to take a call from one of my clients because I'm just assuming somebody's going to arrest me for like drug trafficking. So the current, do you guys have term limits in Illinois? I'm sorry, in Indiana, so the governor cannot run?
Yeah.
Okay.
Yeah. He didn't make a lot of people in his own party happy anyways this last year, let alone the opposition. So I think if he could, he probably wouldn't win.
Well,
I think we, the people, need to begin to rise up and say no to these folks.
Yeah.
We only got ourselves. The big farmers, they got big pocket. When we begin to vote them out and stand for our values and what we want, they will begin to respect us.
And you hit on something there, and I don't want to sound like a conspiracy theorist because I dread those folks, but we are in the state of Eli Lilly. And
Yep.
politics needs funding in order to exist. Lobbyists, the pharmaceutical industry, the healthcare industry, the biggest lobbyist out there. So we're dealing with that. In order for what you think a bunch of farmers or Midwest Hemp Association folks are yet, I hope it grows, powerful enough to take on the pharmaceutical lobby. It's a huge uphill battle, but so far, look at where we're at. It's happening. It is happening. Guys like you are out there fighting,
Well, yeah, but
It's just, you're in Indiana.
there's a lot of issues. And then Wisconsin has got its own set of problems. So in Indiana, I have no idea if they have this type of gerrymandering that's gone in, because Indiana is less of a swing state than Wisconsin, which is about a 51-49 split of Democrats and Republicans, flip a coin. But the Republicans control 2/3 of the House, both the House, the legislature, so the Senate and also the Assembly in Madison, Wisconsin, because they're in charge of drawing the districting maps. So they've gerrymandered the state of Wisconsin to turn a 51-49 state into a 66-33 state.
Ooh.
They don't have a medical marijuana bill. They don't have an adult use bill because it's 66% Republican in the chambers of Congress in Madison, Wisconsin, and they don't care. It's politicized, and I don't understand its politicization, simply because it.
And the resistance is what I'm finding difficult to believe, because by this point, even those who did buy into and promote the propaganda for a very long
For
time,
years.
and it was an all-party problem. No one is free here. Look, we got the administration right now has backed off the whole thing. That's sad, but politics is paid for. And who's paying the bills?
Right.
It's not us at this point, Maybe the right people come along and the industry continues to grow, it will gain lobby power. And the medical or the marijuana industry, the hemp industry, there's money in it now, and that's how things are happening. But yeah, it's going to take a lot to get a bunch of people on board.
I just don't get. I understand the prejudice against this plant prior to 1992. before we knew what the endocannabinoid system was, and before Dr. Mechoulam in Israel isolated anandamide, the CB1 receptor that's in our brains, and then we understood how the plant worked. And we didn't update anything. We didn't update our medical books. We didn't update our curriculum. I was a kid during the time. They didn't tell me that I had an endocannabinoid system, and that's why weed works. I mean, I have cops that watch my show. They wanted to get a cannabis license in Illinois. It's adorable. And so trying to explain to police officers the reason why medical marijuana works is because your body contains an endocannabinoid system, and it's your endocannabinoid system is the chief homeostatic regulator. They're looking at me confused. And then his business idea was, well, they got a chopper because they're cops, and they wanted to like air deliver weed. And I'm like, uh-huh. And so I explained that to him. He goes, well, I guess that's kind of good. I guess our dogs can still sniff bombs. And I'm like, your dogs sniffing weed should not be something that you're like, oh, shucks, we can't do that anymore. You're not just supposed to continue to arrest people wrongly after you've figured out that the whole precept, the whole thesis for your prohibition for public safety is BS.
Yeah, it's 100%
Okay.
BS. Well, reefer madness, man. You don't want reefer madness.
Well, again, you can get away with that when you don't understand how reefer works because you
Yeah.
haven't, and then that's what
It's
Schedule
the
1
cat's
means.
out of the bag. They're fighting a losing battle ultimately.
Lola mentioned she can't get research done because it's a Schedule 1 substance. One more?
Yeah, one thing I do observe is this, you know, states that fight things to do with marijuana always have problem with opioid, cocaine, and all this other stuff. And states that allow, you know, always have reduction in those things, you know. And now a lot of those states that have come down from that strong policing of marijuana, states that have come down have observed reduction in crime, which is true.
Yep.
You know?
And the data gets more and more. You know, I wanted to can you explain, just to close, the relationship between opioid usage and deaths and cannabis, medical cannabis or adult use cannabis becoming the law of the land in a particular state?
Just like Charles just said, even though he didn't know that we have data that show, especially a place like Colorado, that their opioid death rate drop when they legalize cannabis over there. So basically, we need legalization for, it's gonna happen. It's a matter of time. And you know why I said that? All over the world, people are decriminalizing, they are changing their rules. I just feel for us because we're gonna be left behind. But I think the cat is already even out of the bag. To tell you the truth, it's a matter of time. Even in a place like Indiana, people like you kids, people just keep fighting this battle. A lot is changing. A lot is changing, and it's gonna be there. In states that have legalization, there's reduction. And like we said, so many people have died, but there has not been any direct death as a result of cannabis or even psychedelic. What I see in the future is psilocybin, psychedelic, being used, especially in mental health, as a rescue package, whereby they bring in, because that one, you like kids say, you can use it every day, but cannabis can come in as a maintenance therapy because we have seen clinical trials over 90% when they use psilocybin for depression, up to 2 years, they were still effective. So 2 years, they still got up to 60% effective for depression, just one dose of psilocybin. So I see a future where we will use psychedelic to manage as a chronic, then we use something like cannabis, CBD, as a maintenance, just to boost when we need it. Thank you so much for this great panel. I appreciate being here.
Yeah, and thank you to the CBD Expo. We're done.